Hi friends, welcome to the channel The Nurse. Here we are discussing another video of AIIMS NORCET 2023 series. This video is 12th part, and you can, if you are not watched previous video, means you can watch and previous video and come back to this video. In this video, we have discussing some easy questions only. For main reason for that, it will be helpful for revision of topics. So I have included 19 questions here. So if you are scored more than 15 marks, just comment below. So I told you it is a revision, so it will be easier question for you. So we'll try. So if you are not subscribed to our channel, please subscribe, and we will move to the questions. AIIMS NORCET Nursing MCQs 12th part video. First question. Which of the following is a potential complication of a central venous catheter? Hypertension, hypotension, infection, dehydration. Correct answer is infection. So the catheter is inserting into our central veins only, so there is a high risk for getting infection. A central venous catheter is a long, thin tube that is inserted into vein to provide medication, fluid, or nutrition. However, it can also cause the risk of infection if not properly maintained. So this is an example of central venous catheter. This is two port there. So sometimes it will come triple port to give medications. So red, yellow, and one blue port also may come, and this part will insert into the central veins. That may be jugular or subclavian veins. Or it is also we can give through femoral vein, and usually it will insert into subclavian or jugular vein. What is the primary purpose of a hospital information system, or HIS? To provide medical treatment to patients, to store and manage patient information, to manage hospital finances, to manage hospital staff schedules. Here, correct answer is to store and manage patient information. Hospital information system mainly for to store and manage patient information. A hospital information system is a digital system that is used to store and manage patient information, typically including medical records, treatment plans, and billing informations. So it will helpful for next time a patient visit. Third question. What is the primary purpose of a bronchoscope? To view inside the bladder, to view inside the lungs, to view inside the stomach, to view the inside of the heart. So correct answer here, to view inside the lungs. So here is example of bronchoscope, and with the bronchoscope, the physician can visualize the inside of the lungs and bronchi, respiratory tract. A bronchoscope is a medical instrument that is used to view the inside of the lungs, typically to diagnose lung problems, to perform certain medical procedures. Sometimes the physician may need to take bronchial aspirations from lung cavity to send for culture microscopical examinations. That procedure also we can do with the bronchoscope. Fourth question, what is the primary purpose of hemodialysis? So here it is an example of hemodialysis machine. To remove excess fluid from the body, to remove waste products from the blood, to increase the production of red blood cells, to decrease the production of white blood cells. Correct answer, to remove waste products from the blood. So usually urea, creatinine are the main waste products from the blood, and also it will reduce to maintain the electrolyte balance also. Usually sometimes there will be chance of hyperkalemia and all. Then with the help of hemodialysis, that electrolyte balance also we can maintain, but mainly for removing waste products, that is urea, creatinine. So there is a chance to ask image basis question also. So they may ask by showing this hemodialysis machine, and they will ask you to recognize the machine. So this is an example of hemodialysis machine. So this is the dialysate. Hemodialysis is a medical treatment that remove removes waste products and excess fluid from the blood of the patient with the kidney failure. So usually kidney is removing waste products and excess fluid from our body. If it is not working, we need to go for hemodialysis. Fifth question, what is the primary purpose of a defibrillator? To increase blood flow to the heart, to decrease blood pressure, to regulate the heart rhythm, to treat anemia. Correct answer, to regulate the heart rhythm. In arrhythmias and arrhythmia, AFib, ventricular fibrillation, these are the some fatal conditions. In that conditions, to reverse that arrhythmia, we can use the defibrillator. Either we can do defibrillation or we can do cardioversions with the same machines. So this is an example of defibrillator machine. So with the two paddles, we can recognize the ECG rhythm also in this monitor, and we can give the shock. A defibrillator is a medical device that delivers an electric shock to the heart to regulate its rhythm, typically used in cases of cardiac arrest or arrhythmias. This cardiac arrest, actually it is a wrong term. Usually defibrillator is used in the case of ventricular tachycardia and ventricular fibrillation. Ventricular tachycardia also, that is unstable ventricular tachycardia, we will use defibrillation. Usually in cardiac arrest cases, we will not use directly defibrillation. So cardiac arrest is caused by ventricular tachycardia or ventricular fibrillation. In that case, we can use defibrillator. Sixth question, which of the following is a potential complication of hemodialysis? Very repeated questions, so you need to understand this question and answer. Options: hypertension, hypotension, hyperglycemia, hypoglycemia. The chief complication of hemodialysis is hypotension. Hemodialysis can cause a rapid decrease in blood volume. So we already told hemodialysis, during hemodialysis it will remove the excess fluid volume. So during that time there is a chance to drop the blood pressure. So that will leads to hypotension. So that is a potential complication of hemodialysis. Seventh question, what is the primary purpose of a computerized physician order entry? Short form CPOE, computerized physician order entry system within HIS, that is hospital information system. Options are to manage patient appointment, to manage patient billing information, to manage patient medication orders, to manage patient insurance information. Correct answer, computerized physician order entry is used to manage patient medication orders. A CPOE system is a part of HIS that allows physician to enter medication orders and prescription electronically, that is online, reducing the risk of errors and improving the medication safety. So it is also a part of hospital information system. Then eighth question, what is the primary purpose of a cardiac monitor? To measure blood pressure, to measure oxygen saturation in the blood, to measure heart rate and rhythm, to measure respiratory rate. The primary purpose of a cardiac monitor to measure heart rate and rhythm. This is here, it is an example of cardiac monitor. In that there will be heart rate and rhythm, and also it will show respiratory rate, oxygen saturation, blood pressure, etc. So primary purpose is for measuring heart rate and rhythm. A cardiac monitor is a medical device that is used to measure the heart rate and rhythm, typically to monitor patients with heart problems or during certain medical procedures. So nowadays a cardiac monitor is attached with the various monitoring devices. Even we can monitor arterial BP or central venous pressure. That and all we can measure with the same cardiac monitor, but main purpose or primary purpose is to monitor heart rhythm and rate. Ninth question, which of the following is a potential benefit of implementing a HIS? Improved patient outcomes, increased hospital staff workload, decreased patient satisfaction, increased risk of medical errors. So potential benefit is improved patient outcomes. So that is a benefit of HIS. A hospital information system can provide several benefits to hospital and patients, including improved communication, increased efficiency, and better patient outcomes through a coordinated care. Because the patient's details, everything will be available online. So the doctors or the healthcare workers can view or review it from their room, and they can do the treatment criteria. So that is why it is important in patient improving patient outcomes. 10th question, what is the primary purpose of an intensive care unit? To provide long-term care for patients with chronic illness, to provide emergency care for patients with a life-threatening condition, to provide basic medical care for patients with minor injuries, to provide specialized care for patients with critical illness or injuries. So here correct answer is to provide specialized care for patients with a critical illness or injuries. So ICU's main purpose is for somewhat specialized care, or sometimes it may be cardiac ICU, that is specifically for cardiac diseases or cardiac disorders, or sometimes neonatal ICUs, that is specifically for newborns. And sometimes there will be specifically medical ICU for general medical conditions. So like that, ICU is for specialized care for patients with the critical illness. So if patient is improved from ICU, then we will transfer the patient to next level of patients, like high dependency unit. Before shifting the ward directly, we will shift the patient to high dependency unit. After improving little bit more, then patient is shifted to ward. So that is a procedure to make the treatment plan. An ICU is a specialized unit in a hospital that provides intensive care for patients with life-threatening conditions such as severe injuries or illnesses. So in that ICU setup, the patient will get direct patient care. So usually in ICU scenario, 1:1 patient nurse patient ratio will be there, and the patient will get better care. 11th question, what is the primary purpose of an endoscope? To view inside the bladder, to view inside the lungs, to view inside the body cavity or organ, to view inside of the heart. Correct answer is to view inside the body cavity or organ. Endoscope means it is a general term for if it is specifically if it is like bronchoscope, means it is used to visualize the bronchi or respiratory tract and lungs. Sometimes gastroscope or GI endoscope, that is for visualizing gastrointestinal tract and stomach. So in here it is just general term used, that is endoscope. Endoscope is used for generally a body cavity or visualize a body cavity or organ. So I will explain to you. An endoscope is a medical device with a light attached. There will be a light source in the tip of the endoscope. So the doctor can visualize the area in screen, or direct they can visualize through the lens. It is used to look inside the body cavity or organ. The scope is inserted through a natural opening such as mouth during a bronchoscopy or rectum for a sigmoidoscopy. Then visualize in the on the screen. A medical procedure using any type of endoscope is called endoscopy. So the procedure using endoscope is known as endoscopy, or the visualizing the the area or cavity with an endoscope. It is known as endoscopy. 12th question. Which of the following is a potential disadvantage of implementing a HIS? Increased efficiency in hospital processes, increased accuracy of patient information, increased risk of data breaches, increased patient satisfaction. So here it is asked disadvantage. So you can eliminate some options easily because this and all includes in the cases of benefits, but in question it is asked disadvantage. So only thing is like a disadvantage, that is increased risk of data breaches. So like you can eliminate the other options and you can easily find out the answer. Correct answer, increased risk of data breaches. A HIS can increase the risk of data breaches and privacy violation if proper security measures are not in place. So some hacker can get the details if the cyber security is not that much tight, means the any hacker can get the patient's details. So that is one of the disadvantage of the hospital information system. 13th question. What is the primary purpose of a pulse oximeter? To measure blood pressure, to measure oxygen saturation in the blood, to measure heart rate, to measure respiratory rate. Correct answer, to measure oxygen saturation in the blood. The primary purpose of the pulse oximeter is the getting oxygen saturation in the blood. So along with that, it will show the heart rate also. But if it is showing asking primary purpose, that is oxygen saturation. A pulse oximeter is a medical device that is used to measure the amount of oxygen in the blood, typically by placing a sensor on a finger or earlobe. Earlobe we will usually using for pediatric cases or infants. 14th question. Which of the following is a potential benefit of implementing a patient portal within a HIS? Improved communication between patient and healthcare providers, increased patient anonymity, decreased patient access to healthcare information, decreased patient involvement in healthcare decision making. So here it is a benefit is asked. So correct answer here, that is a patient portal is a part of HIS that allows patient to access their health information and communicate with healthcare providers. So if it is entered in online, the patient can view the reports and the treatment plan through online, and they can communicate with the healthcare providers again regarding their treatment plan. So this can improve patient engagement, communication, and satisfaction. Next question. Which of the following is responsible for transmitting sound waves to the inner ear? Inner ear. Cochlea, eardrum, auditory nerve, ossicles. Correct answer is ossicles. Ossicles means that is small bones in the ear. So in the middle ear, the ossicles transmits sound waves to inner ear. From eardrum to inner ear, the ossicles are transmitting sound waves. The ossicles, which includes, there are three types of ossicles or bones. They are malleus, ingus, and stapes, are tiny bones in the middle ear that transmit sound waves from eardrum to inner ear. 16th question. Which part of the eye is responsible for controlling the amount of light that enters the eye? Iris, pupil, retina, optic nerve. Correct answer, iris. Iris will control the light, how much light should enter into eye. So according to the light brightness, the iris will control its size because it will act like a door. The iris is the colored part of the eye that controls the size of the pupil, which in turn controls the amount of light that enters the eye. So it will act like a door. Which of the following is a common symptoms of allergic rhinitis? Tinnitus, vertigo, sneezing, hearing loss. Correct answer here, sneezing. Sneezing is a common symptom of allergic rhinitis. Allergic rhinitis is also known as hay fever. Allergic rhinitis is also known as hay fever, is an allergic reaction that causes symptoms such as sneezing, itching, and a runny or stuffy nose. Which part of the ear is responsible for maintaining balance? Cochlea, eardrum, vestibule, semicircular canal. Correct answer is the balance is maintained by semicircular canals in ear. Semicircular canals are part of the inner ear and are responsible for maintaining balance and spatial orientation. So it will give an idea to the brain in which position is in body, lying down, sitting or standing, like that, and it will give a spatial orientation. So it will help us to make balance. So 19th question, it will be a last question today. What is the primary purpose of the plasmapheresis? To remove excess fluid from the body, to remove waste products from the blood, to remove antibodies or other harmful substances from the blood, to increases the production of RBCs. So main purpose of the plasmapheresis is to remove antibodies or other harmful substances from the blood. So in usually it is used in the cases of autoimmune diseases, that is the antibodies against our own immune system. So in that cases, plasmapheresis will remove the excess antibodies or the antibodies that attacks in our own immune system. It will get removed during plasmapheresis. So that is about plasmapheresis is a medical treatment that removes plasma from the blood and replaces it with a substitute solution, typically used to remove antibodies or other harmful substances from the blood. It's same like dialysis, but in the here it is removing antibodies. In dialysis, it is removing waste products. So that is the difference between plasmapheresis and hemodialysis. In hemodialysis, it removes waste products from the blood. In plasmapheresis, it removes antibodies or some harmful substances from the blood. So that is about today's video. And if you have any doubt means you can ask in comment sections. And thank you for watching this video. If you have any question or any doubt means you can ask in comment section. And please like and subscribe our channel. And also you can share with your friends. So that is about today's video. So thank you.